When patients and I discuss liposuction, it's important to point out several different aspects of liposuction. One, just because we remove the fat doesn't come back somewhere else. That's a myth that patients often ask and talk to me about. Two, as a result of removal of the fat, we're really trying to just redrape the skin over the involved areas. Perhaps the flanks need to be tightened so that we can restore that youthful shape at the hips. In order to do this, this may require several different small incisions and allow us to remove the fat through a long cannula. Healing is fast, minimal bruising, and a fast recovery often results in a fantastic result and a happy patient. The concept of liposuction is pretty simple. Think about removing the fat. It's something that we all want to do, and we even try with diet and exercise. But there are some places where diet and exercise are just not very functional. We remove that fat through making small incisions in the skin, and through a long tube remove that fat, usually in the operating room. Once that fat's removed, it's permanently erased and will never return. Liposuction has a very fast recovery. Most of my patients tell me that they feel a little uncomfortable for only several days after the procedure and often have minimal bruising. The incisions heal well, they're allowed to shower the next day, and return to normal activity within about a week. Liposuction is done through a very minimal set of scars, usually about the width of my small finger, about 1.5 centimeters. These usually heal well and over a long period of time become faint little lines that become hard to see. After liposuction, I'll have my patients wear a body wrap for about a month after the procedure. Oftentimes they feel so comfortable in the body wrap that it may be hard to get them out of it. The body wrap is important as we try to redrape the skin over the areas where the fat has been removed. We want to encourage that skin to ultimately maintain the shape that we're going for. Patients often ask me, do I have to change my eating habits after liposuction? And I tell them if they want to maintain the liposuction look, it's important to maintain a healthy diet as always, along with exercise. I often tell them if they go on the all Big Mac diet, they can expect to put on fat probably somewhere else, but as a result of poor diet control. Patients often ask me about safety in liposuction. Liposuction is a very safe procedure. It's one of the top 5 procedures annually performed by plastic and cosmetic surgeons. It is felt to be very safe and certainly done in the right hands and in a safe place, patients will have a fantastic and excellent outcome with very little downtime. I've been performing liposuction for over 7 years and certainly have understood in that time that there's a variety of different ways to be able to get the best results for patients. This can involve a variety of different surgical approaches, smaller incisions, and sometimes different cannulas to be able to achieve those results. Patients come to me with a variety of different places that they're concerned about fat removal. Sometimes around their ankles, the dreaded cankles, sometimes around the knees, inside the thighs, the outer thighs, the love handles, the neck, and even the arms. Depending on skin tone, elasticity, and a variety of different elements on each patient, liposuction can be performed safely in a variety of different areas or anywhere where there's excess fat. There's only been one type of fat removal that has withstood the test of time, and that is liposuction. Not necessarily liposuction done by lasers or by ultrasounds or by other pills or creams. Liposuction directly removes the fat and has done so since the 19th century when liposuction was first described. It has withstood the test of time and is the standard in treatment for decreasing excess fatty deposits throughout the body.
If you would like more information, don't hesitate to call our telephone number at area code 502-589-5544. Thank you for your attention.